Hello. Angle my nice camera, don't mind me. Hi, I am hopping on here real quick to talk about all things core and diastasis, and especially with pregnancy, growing belly, and postpartum. So we're just going to do a quick chat. If you have any questions, throw it in the comments and I'll answer your question real quick. But just kind of a brief overview of things to think about, things to look for in regards to core and diastasis when it comes to pregnancy and postpartum. Hi, Libby. Okay, so first we'll just kind of define what core is. Some people, when they hear the word core, they automatically only think ab muscles, which is not true. That's a part of your core, but it is not the entire core. So we train the core as a system. So when you think of your core system, think of it either as like a balloon or like a pop can. There's a top, there's a bottom, and then around the middle. And so a highly pressurized system. So at the top you have your diaphragm, at the bottom you have your pelvic floor, and then around you have your deep abdominals. So when we're training your core, when you're thinking about your core, think of the entire system. Try to avoid thinking just your abs, because that is an important part of it, but that's not the only part. And especially when it comes to pregnancy and postpartum, there is so much more that they all need to work together, especially if you have diastasis or you're trying to avoid getting diastasis, everything. They all work together. Also, as I'm getting more pregnant, I feel like I talk and I run out of breath. So if I stop and breathe for a second, don't mind me in my belly. Okay, so diastasis. If you are pregnant or during pregnancy, so we'll kind of talk about it during pregnancy and after you have a baby. So during pregnancy, so kind of the stage I'm in right now. I've gone through this with my first pregnancy. Did not have any concerns of diastasis before. First baby, then during pregnancy, it's natural for everybody. You have more relaxin, things are more mobile. You need that kind of stretch and give in your connective tissues for your hips to widen, your belly to grow. So it's totally normal to have diastasis during pregnancy. So don't get like, oh my gosh, my world's over. But there's totally stuff that we can do to decrease your risk for the severity, to decrease your risk for turning into lingering anything postpartum, that you can get right back into exercise when your body's ready postpartum and it doesn't turn into a thing that you're now dealing with 6 months, a year, going into next pregnancy for it to continue. So diastasis by definition means separation of abs. Think of it bigger picture too. So if you look at belly muscles, so what the diastasis is we're looking at the connective tissue straight down the center, down the linea alba. So you have your ab muscles on each side connected in the middle. And so this is the connective tissue that we're talking about. So with diastasis, this tissue has either widened, which when you're pregnant, it's natural for it to widen because your belly is growing and it's needed for your abdomen to stretch and your abdominal muscles to stretch. And it's also thinning. So when we assess it here, we're looking at the thinness, so how far do our fingers sink in, and the width. So there's two components. Some people only think about the width. Also the depth is just as important. How thin is it? The thinner it is, the less supported it is, the more likely you're gonna see it cone out. So if I use the word coning, different words you can use, coning, doming, insert whatever you want here. But what I'm talking about is if you've ever seen, if you have it on your own, when you do something, for example, if I was laying down in bed and sitting straight up, it pushes straight out. So try to avoid when you're pregnant and when you're postpartum, anything that causes coning or doming. If you are trying to do a crunch or a sit-up or a plank, those are going to be the most common things that lead to that kind of lifting right here. What that is it means that it's just not strong enough, it's not supported enough. It's that pressure management in that whole system, something's off, and it's giving in the path of least resistance, which is your linea alba in the diastasis recti. And so try to avoid doing any of those kind of things. So pay attention to it, think about it. I have an example during pregnancy that I noticed it was even like if I'm lounging in the bathtub and trying to sit up, if I'm laying in bed, trying to sit up, especially now like planks, more ab focused core exercises, just kind of be mindful, pay attention. That's a red flag to kind of watch for. Do I see it popping out? Avoid those things, pregnancy and postpartum. Another thing to think about is posture. So we talk about posture all the time. If you think about those muscles, it's housed diaphragm in the rib cage, pelvic floor in the pelvis. And so pay attention to your posture for that. If you're pregnant or postpartum and you're leaning back more just because weight's forward, then now instead of your nice little pop can has now turned to the side, stacked, it is dipped back. That's gonna put even more stretch on your ab muscles, even harder for your diastasis. Okay, now you have the baby and you're carrying the baby. If you're still leaning back, trying to get the baby to calm down, go to sleep, any of those kind of things, you're leaning back, stretching here more. Posture is gonna be a huge thing. You want optimal alignment for the core system to work most efficiently. And the last kind of tip is pay attention to your breath and your pelvic floor. So we talk about breath all the time, and I'll kind of just give a quick brief overview. If you check out our Breathe at Home, we go into all this stuff in more detail. We give you cues, walking through exercises, what to think about, all this stuff. So if the breath sounds confusing at first, that's another great service. It's an exercise subscription, so you can walk through a full exercise sequence with all the cues, thinking about diastasis, posture, core, all this stuff. So great resource. This is big picture. Big picture, inhale, relax, exhale, engage. Inhale, relax your core, exhale, engage your core. So if you're, and when I say core, pelvic floor, diaphragm, deep abdominals, all as a team at the same time. So when you're going to pick up your baby, inhale, exhale as you stand up. Picking up car seat, inhale, exhale as you stand up. If you are postpartum and you're starting to exercise, exhale with the effort. So if that's doing a squat, for example, just like picking up your kid, inhale, exhale, draw in. Inhale, exhale. Apply that to any exercise you're doing. Pay attention to how your pelvic floor feels, how your rib cage feels, how your deep abdominals, diastasis feels. Think about it as a team. It all works together. If you have any questions about how it works together, or if you had your baby and you're getting back into exercise, but you just don't know if you have diastasis or if you are protecting it in the right ways, give us a call. We can get you in, we can see you, or check out our subscription and follow along with our cues. I will leave that in the comments, and you can check it out if you're interested. Thank you.